When that really bad, debilitating back pain hits, surgery can feel like the only option on the table. But what if it's not? What if there's a different path to healing? Today, we're going to dive into a really powerful, holistic way to treat severe back injuries, one that's rooted in the principles of Korean medicine. I mean, just listen to that. That isn't just a dramatic line from a movie. This was the actual daily reality for the person whose story we're following today. It just perfectly captures that feeling of desperation, right? When pain completely takes over every single moment of your life. So we're going to follow the journey of a guy named Joe, a professional in his 40s. And his experience, it really gives us a powerful look at a different kind of path, a holistic one that took him from just crippling pain all the way back to a normal, functioning life. So for Joe, believe it or not, this whole thing started with something incredibly ordinary, just a weekend spent out in the garden. But what happened next? Well, it was anything but ordinary. The progression was just alarmingly fast. What started as, some minor back pain and a little tingling, it escalated like crazy. Within weeks, the pain got so bad he was actually losing weight because he just couldn't eat properly. So he gets an MRI, and it delivers this stunning diagnosis: ruptured discs in count 'em, 4 separate vertebrae. And the doctor's immediate recommendation? Surgery. Okay, so that term, ruptured disc, was the key here. And it's way more severe than a herniated disc. It's actually really crucial to understand the difference to get why Joe's situation was so extreme. So think of it like this. A herniated disc, it just slips out of place and pinches a nerve. Bad, but manageable. A ruptured disc, which is what Joe had, that's a whole other level. The disc actually tears open, and the gel-like stuff inside, the nucleus pulposus, leaks out. And that leakage triggers the severe inflammation, which leads to that intense pain, numbness, and that really distinct pulling sensation. So, facing surgery, Joe decided to explore Korean medicine, which looks at the problem completely differently. The philosophy here isn't just about managing the pain you feel today. No, it's about treating the underlying cause, the root of the problem, to make sure it doesn't come back. Now, that's a fair question, right? A lot of us hear back pain and we immediately think, go to the chiropractor. And yeah, that's often part of the solution. But in a case like this, it is definitely not the whole picture. And here's the crucial part. If you don't treat that deep inflammation and swelling first, the problem is just going to keep coming back. The injured ligaments are just too weak to hold the spine in place. That means any chiropractic adjustment is really just a temporary fix. You've got to heal the foundation first, otherwise it's all for nothing. And this brings us right back to Joe's story and the really comprehensive, multi-step treatment plan that helped him avoid that operating table and, actually get back to his life. The treatment was basically a 3-pronged attack on the problem. It combined herbal medicine, chiropractic care, and a pretty specialized form of acupuncture. Each piece of this puzzle played a really distinct and vital role in his recovery. So step 1, the foundation, was herbal medicine. And this wasn't just for pain. A carefully prescribed blend of herbs went to work tackling that severe inflammation around his nerves and discs, while also strengthening the very ligaments and bones that support the spine. It was all about rebuilding the entire structure from the inside out. Now, because Joe could barely move, they used this incredibly powerful technique for his acute pain. It's called motion-style acupuncture treatment, or MST. And this is a really dynamic approach, totally different from the lie still and relax kind of acupuncture most of us picture. The benefits of MST are pretty remarkable. It's specifically designed for people in so much pain they can barely move. By having the patient do these super gentle movements while the needles are in, it works to rapidly loosen up all those tight, seized-up muscles. And the results? They're often felt almost immediately, sometimes in just 20 minutes. Wow. So Joe's story is an amazing testament to this kind of integrated approach. But maybe the biggest takeaway for all of us is just how critical it is to get an accurate diagnosis right from the very beginning. Look, it's so easy to dismiss back pain as just a simple sprain, right? Something that'll get better on its own in a couple weeks. But a disc issue, that's a different beast. That pain is very likely to come back, and it's often worse than before. Plus, it can bring some really serious symptoms with it, like numbness or weakness. So these are the red flags. These are your warning signs. If your back pain is way more severe than you'd expect, if it keeps coming back, if it feels like it's getting worse day by day, or if you feel any kind of numbness or muscle weakness in your legs, it's time to stop guessing. Those are clear signals to see a specialist and get a proper diagnosis with an X-ray or an MRI. Ultimately, understanding the true source of your pain is the absolute first step toward actually healing. Joe's journey shows us that even in really severe cases, powerful alternatives to surgery are out there. But it all starts with getting that precise diagnosis. So I guess the question is, are you truly listening to what your body is trying to tell you?